So looking at the 5 rights of medication administration. The first thing that you want to check is that you have the right patient. So we do this by first checking the name on our medication order, which you can see is at the top here. And you want to check it against your physical patient in the bed, making sure that this medication chart is intended for this patient. We do this by checking 3 identifiers. The first is their full name, their date of birth, and their MRN or medical record number. So when we're checking our patient's name, we can simply ask them, what is your full name? And your patient should be able to tell you. Your next question is, what is your date of birth? Again, your patient should be able to tell you. If they can't, we can simply look on their name band, so their name bracelet. And this is just one that's that I've quickly made up. So this is our patient. This is Laura Mayer. This is her date of birth and then her medical record number. So this would be around her wrist. Now, it's not, some patients may know their medical record number, but you can't assume that they all will. So it's good to check the information on this and the information that your patient is giving you and against your medication chart. One little tip that I'd like to offer you now is if you're asking your patient, if you're asking your person their name, date of birth, checking their MRN, the next and quite simple question to ask is, do you have any allergies? Knowing that we are giving them medication that they may be allergic to, we do need to check their allergy status, and it's good to do it early so that we know that we're safe to progress with the medication administration. So first 5 rights that we've covered is the right patient. The next one we're going to look at is the right time. So looking at our medication order, we're going to stick with paracetamol. Nice and simple, a medication we're all familiar with. So when we're looking at that it's the right time, is to look at your medication order. So we know that we've got we've got paracetamol due at 2 o'clock. Quick, let's check what time it is. Oh, it's 2 o'clock, so we know that we are good to give paracetamol at 2 o'clock. But we do need to check other things when checking it's the right time as well. To give this medication, we want to check the frequency of when it's been ordered. So frequency is TDS, so 3 times a day. We want to check that you're giving the medication at the right time. And you want to also confirm when the last dose was given. So we're needing to know when it's safe to give this medication. Whilst it's been written as TDS, it is up to the nurse to make sure that it's actually safe to give this medication 3 times a day. So you don't need to memorize all of this. You actually go on to a medication database called MIMS. This is an example of a paracetamol information sheet that you would access off MIMS online. So go onto the database, you search paracetamol in the search bar, it comes up with a whole lot of results, and you find the Panadol or paracetamol that you're administering. So you can see here looking for the frequency, so how often can we give it? You sort of have a quick look down and it says down here, paracetamol can be given every 4 to 6 hours as needed in adults or children over 12 years. Yeah, so every 4 to 6 hours. So looking back at our medication chart, you can see here every 4 to 6 that she's been charted at TDS, which is every 8 hours. So technically she could have it more frequently if she needed to, but it is safe to give it 3 times a day. So yep, we're good to give it. The other thing we want to check is we want to confirm when the last dose was given. We don't want to overdose her. Now we can see here she's had it at 8 o'clock. You should also confirm this with your patient as well. Did you have some Panadol with breakfast this morning or at 8 o'clock, and have you had any Panadol since, any paracetamol since? It's always good to double check because the last nurse may just have not signed the medication order that has actually dispensed it. So it's always good to check with your patient. The next five rights to check is that it is the right dose. So here we're checking our order. It has 1 gram or 1,000 milligrams. We want to confirm that this is the right dose for Laura. Yeah. So again, we want to go back to our database and we want to check, okay, so adults and children over 12 years can have 1 to 2 capsules and a max of 8 capsules in a 24-hour period. Looking further down, we've got 500 milligrams in each capsule. Yeah, so she has been charted, let's check, 1 gram or 1,000 milligrams 3 times a day. So we can say, okay, that is an appropriate dose. The next part of checking the 5 rights in terms of the right dose is checking that is calculating how many tablets you're giving. So checking is calculating the dose that you're administering. So here it's quite an easy medication calculation. We want to give 1 gram or 1,000 milligrams, and our database says that they come in 500 milligram tablets. So stock strength required over stock strength. So it's 1,000 milligrams over 500 milligrams. So we're giving 2 tablets. The next part of 5 rights is the right route. So checking on the order, okay, she's been charted it as oral. We can see here PO is oral. We want to check the appropriateness and confirm that Laura can actually have that medication orally. For example, she may be fasting because she's going in for an operation, or she may be nil by mouth because she's having some assessment, or perhaps she needs to be reviewed by someone to see if she is safe to actually swallow medications. So the first place you go to find out this information is your patient. So ask Laura, are you okay swallowing this tablet, these 2 tablets? Yes, okay, good. You can continue. All right, so the last one, so we've done right patient, right time, right dose, right route, and now we've got to find out if this is the right drug. So we want to check that the person who's ordered this has she should be receiving paracetamol. So from our handover earlier, we know that Laura has been admitted for mastitis, which is an inflammation of the breast tissue secondary to breastfeeding complications and backlog of breast milk. This is extremely, extremely painful. So knowing that paracetamol is a analgesic, which we know from our database, you can see here, paracetamol is a simple analgesic, so it treats pain. So we can say, okay, yep, we can see why why Laura would be prescribed paracetamol. The other thing that paracetamol also does is that it's an antipyretic, meaning that it brings down your fevers. Laura may be experiencing fevers secondary to the inflammation caused from this mastitis. So you can say, yep, this would be the right drug for Laura. Okay, we can see why she would be charted paracetamol. When we're checking our right drug, whilst it doesn't apply to paracetamol, you, as a registered nurse, you are often dispensing medication that may alter certain observations. So if you are dispensing an antihypertensive, that often you will need to complete a set of observations before you dispense this medication, because you've got to think, if your patient if their blood pressure is already low, you do not want to be giving them a medication to lower their blood pressure. So that's something else when you're checking your 5 rights. Is it appropriate for this patient to have this drug? Is it the right drug? Yeah, and when we're checking and dispensing this medication, we want to check that it's the right drug. So we're looking at the label of the packet, we're looking at the expiration date, and you're also looking at the integrity of the tablet or the medication that you're dispensing as well.